Hello everyone, it's Dr. Danielle Cooper here, plastic surgeon. I wanted to create a video to discuss the different combinations of procedures that we do as plastic surgeons. So I'll start off with the face and then work my way down to the body. So pretty much, if you want to, you can combine multiple procedures of the face. Common things that people have done to their face would be brow lifts, upper and lower eyelid lifts. You can have a rhinoplasty, which is nose surgery. You can have a facelift or a neck lift. You can also do fat grafting to the face as part of those procedures as well. So I would say, as far as facial procedures go, if you want to, you technically could probably combine all of those procedures together, but that would be a very long procedure and a lot of recovery for the patient. However, I do know that there are people that do combine all those procedures together. Is just going to be the patient really understanding what that recovery is going to look like. But I would say most commonly combinations that are seen are doing a brow lift and probably eyelid surgery because the brows and the eyes are in close proximity, and so typically we would want to address both at the same time if that is needed. So you can typically do a brow lift and then get your upper eyelids done if you still have excess hanging or loose skin on your eyelids, as well as address your lower eyelids if you have bags underneath your eyes that you want to have addressed. So I would say that's one common or a couple of common procedures that are done together. Another thing would be a face and neck lift. So very common if you're addressing the face to go ahead and address the neck as well, because all of that is just one continuation of skin draping. So from the face, it just continues down onto your neck. And so usually with aging, you have signs of aging in both your jowl region, which is the lower face, as well as in your neck. And so combining the face and the neck together is something that is done very commonly. You can also combine eyelid procedures with your face and neck lift. That is something that is commonly done. With rhinoplasties, most people, I would say, probably do them as its own procedure, but it can be combined with any of the other facial procedures. Again, it just comes down to a discussion of what your recovery would look like. But I would say probably what I've seen most commonly is if you're having a rhinoplasty done, it's probably done alone. Maybe the surgeon may consider doing the eyelids along with the rhinoplasty, since you're probably going to end up with black and blue eyes anyway. But again, it can be combined with other facial procedures as well. And then as far as fat grafting to the face, that's commonly done with your face and neck lift, because again, with those procedures, you're trying to rejuvenate the face. And as we age, we lose fatty volume to our face. A full fatty face is actually a youthful face. So when we're doing our facelifts, we're wanting to add volume to the areas of the face where we've lost volume. And that's what makes us look older. And so fat grafting is common to add in addition to your face and neck lift. Now moving on to the body. The body kind of consists of breast surgery as well as your trunk, which means your abdomen and your back. And so it's very common to combine breast and body procedures. So for example, mommy makeovers is a combination of doing something with your breast as well as with your belly. So common things that we include in a mommy makeover, for example, would be a breast augmentation or a breast lift with or without implants, or breast reduction that we do in combination with usually a tummy tuck, but it can also be in combination with 360 lipo. So that's just something, again, that you would just have a discussion with your surgeon as to what combinations of procedures that you would want from your breast and your belly perspective. Now, there are other body procedures like the BBL, and this will be surgeon dependent on whether they will combine a BBL with other procedures. And the reasoning is because the recovery can be a little tricky with positioning, as well as it's a lot of surgery. It's a lot that your body's trying to recover from. So for example, if you want a BBL, that means we're doing 360 lipo and we're taking that fat and we're transferring it to your buttock region. We do not want you to put pressure on your buttock after surgery. So that usually means that we want our patients laying on their bellies so that they take pressure off of their backside. So that usually means we don't want to do a breast procedure on you because we don't want you laying on your freshly placed implants, or if you had a breast reduction or breast lift, your fresh incisions. We don't want you putting pressure on your chest after a breast procedure. So we wouldn't combine necessarily a BBL with a breast procedure. Same thing with a tummy tuck. If you think about it, when we do a tummy tuck, we pull your skin down nice and tight, and you start off initially hunched over until that skin has time to relax. And so usually we're having you sleep on your back in what we call a beach chair position, where you have pillows behind your back and underneath your knees to keep you flexed at the waist while you're sleeping during your recovery. And obviously, if you're sleeping on your back, that means you would be putting pressure on your backside. And so typically, again, a tummy tuck would not normally be combined with a BBL. And I say typically because there are surgeons out there that will combine those procedures. They just come up with creative ways for their patients to sleep postoperatively to pressure offload those areas as needed, or to keep the patient flexed, for example, if they did a tummy tuck and a BBL. And so those would be discussions that you would have with those surgeons that do decide to combine those procedures. But I would say my explanation that I discussed earlier is probably the most common reason as to why a lot of surgeons do not combine those specific procedures. So that's just something to keep in mind. As far as extremities go, so if you're wanting arm lipo, thigh lipo, or an arm lift or a thigh lift, that's going to be surgeon dependent. Everybody has their own thoughts on what they are okay combining with other procedures. So for example, some surgeons may be okay doing arm lipo in addition to your breast augmentation, because they're going to restrict your arm movements anyway after the breast surgery. So kind of combining those two procedures together kind of makes sense from a recovery standpoint. But the surgeon may not want to do a full arm lift in addition to your tummy tuck, for example, because you need to use your arms to kind of get you around postoperatively, and they may worry about you developing wounds if you're using your arms too much to mobilize yourself when you've just had a tummy tuck. But again, that's going to be surgeon dependent on how comfortable they feel with combining those procedures with other body procedures. And the same thing goes for the legs as it does for the arms. I would say probably more commonly, surgeons will not combine arms and legs together, because then that takes out all four extremities, and that pretty much leaves you kind of helpless. However, it probably also depends on what the surgeon has to do to those extremities and how involved the procedures would be, to determine whether or not the surgeon still thinks it would be safe enough for you to have all four extremities operated on at the same time. So I hope that that gives you guys information on the common procedures that we combine. But again, just have a discussion with your surgeon on what you're interested in and what can be combined safely for you.